Hello and welcome. Today, we're diving into a rare but impactful eye condition called Thiel-Behnke corneal dystrophy, or TBCD. This video will explore what TBCD is, its causes, symptoms, diagnosis, and the current approaches to managing it. Let's get started on understanding this corneal dystrophy. So, what exactly causes Thiel-Behnke corneal dystrophy? TBCD is primarily a genetic condition, meaning it's passed down through families. It's specifically linked to mutations in the TGF-beta gene, also known as the BIGH3 gene, located on chromosome 5. This gene provides instructions for making a protein called transforming growth factor beta-induced protein. While we know the gene involved, the precise mechanism by which these mutations lead to the corneal changes is still under investigation. Now, let's talk about what's happening inside the cornea. The TGF-beta protein, when functioning correctly, plays a role in the structure and organization of the corneal tissue. In TBCD, the mutated TGF-beta gene produces an abnormal protein. This abnormal protein accumulates in the cornea, specifically within Bowman's layer and the superficial stroma. This accumulation forms characteristic curly fibers and subepithelial deposits, disrupting the normal smooth surface of the cornea. This disruption leads to the symptoms associated with the dystrophy. Thiel-Behnke corneal dystrophy is considered a rare condition. It affects individuals of various ethnic backgrounds, but precise prevalence data is limited due to its relative obscurity and potential for misdiagnosis. It is inherited in an autosomal dominant pattern, meaning that only one copy of the mutated gene is necessary to cause the disease. Therefore, if one parent has TBCD, there's a 50% chance that their child will inherit the condition. The symptoms of Thiel-Behnke corneal dystrophy typically begin to appear in early childhood or adolescence, although some individuals may not experience symptoms until later in life. Common symptoms include recurrent episodes of corneal erosions, which cause sharp eye pain, light sensitivity, and excessive tearing. Patients also frequently complain of foreign body sensation and decreased vision, which can fluctuate. The severity of symptoms can vary significantly from person to person. Diagnosing TBCD involves a comprehensive eye examination. An ophthalmologist will use a slit lamp microscope to examine the cornea for the characteristic findings, such as the subepithelial corneal deposits which appear as honeycomb or fingerprint-like patterns. Corneal topography can map the corneal surface irregularities. Genetic testing can confirm the diagnosis by identifying mutations in the TGF-beta gene. A corneal biopsy might be performed, although it's less common, to examine the corneal tissue under a microscope. While we don't classify TBCD into distinct types, in the traditional sense, it's important to note that the severity and presentation of the condition can vary. The location and density of the corneal deposits, as well as the frequency and severity of corneal erosions, can differ among affected individuals. This variability likely reflects differences in the specific TGF-beta mutation and other genetic and environmental factors. Unfortunately, there's no cure for Thiel-Behnke corneal dystrophy. However, treatments focus on managing the symptoms and preventing complications. Lubricating eye drops and ointments can help keep the cornea moist and reduce the risk of erosions. Bandage contact lenses can protect the cornea and promote healing after an erosion. In severe cases, surgical interventions may be necessary. Options include superficial keratectomy to remove the abnormal tissue, phototherapeutic keratectomy or PTK, which uses a laser to smooth the corneal surface, and, in some cases, corneal transplant like Thiel-Behnke deep anterior lateral keratoplasty to replace damaged corneal tissue. Because TBCD is a genetic condition, there's no way to entirely prevent it. However, genetic counseling can be beneficial for families with a history of the disease who are planning to have children. This can help them understand the risk of passing on the condition and explore available options for genetic testing and family planning. The prognosis for individuals with Thiel-Behnke corneal dystrophy varies. While the condition is progressive, meaning it tends to worsen over time, most individuals can maintain functional vision with appropriate management. Surgical interventions can often improve vision and reduce symptoms, but the dystrophy can recur in the transplanted cornea. Research is ongoing to better understand the underlying mechanisms of TBCD and to develop more effective treatments, including gene therapy approaches that could potentially correct the underlying genetic defect. Scientists are also investigating methods to prevent the recurrence of the dystrophy after corneal transplantation. These advancements offer hope for improved outcomes and quality of life for individuals affected by Thiel-Behnke corneal dystrophy.